I believe we are live. Wonderful. Hello, everyone. So we're here again. It's working really well, this, the Holistic Vet Sisters. We're all really, really pleased to be here. And we've had some amazing guests the last few months. And we've also had some lovely, lovely questions from you all. And we've been inundated with questions for tonight as well, which is brilliant. So we're going to get through as many as we can. So sisters here tonight, Tina, who goes under the brown purple vet, that's why it says that, Dr Lise Hansen, myself, Caroline Griffith, and Vicky Simon is with us. Now she has her herbalist account again, because she is a veterinary herbalist amongst other talents, including childcare. Now, she is a super mum.
And super vet.
Yeah, well, of course, we're all fabulous at that. So anyway, Tina, our first question, let's dive in.
Yeah, we got so many questions today, so I think it's good to just get cracking. So maybe we could start. There's Brenda had a question. I guess it's a bit follow up from our previous live. We talked a little bit about pancreatitis. Her question was, well, she had 3 different questions, but how does pancreatitis become fatal, and what causes a blockage in the bile duct, and what causes a rupture in the gallbladder?
3 different organs there.
Yeah. A lot of questions.
Well, pancreatitis is inflammation. So, I mean, basically, if it's not dealt with, it will continue to be inflamed. That would be my initial. I mean, or an injury, perhaps. It could be an injury. Maybe they get kicked, or that's just something you wouldn't want happening. But go on.
So initially, the issues with pancreatitis is you get the enzyme that are activated like too early, prematurely, and then it ends up initially digesting itself and digesting the other organs as well, which can cause a lot of damage. Yeah, I don't know if anyone wants to add anything.
Well, I mean, it would get worse though, wouldn't it, if it wasn't dealt with diet-wise, for sure. So yeah. That's going to have to be.
But also, I think the reason that it actually becomes fatal is in the cases where you can't get them to eat. Mm-hmm. And you also, because in my experience from cases that I've seen and owners that I've spoken to, those are the cases. So if you can get them to eat, if you can get them, effectively back to functioning normally, then you can then manage it and everything's okay. But in those super acute ones, they can be so painful, they can feel so unwell that you just can't get them to consume anything. They might be on fluids at the vet, but if you can't get them to eat anything, then it becomes fatal, because if they're not eating, then they just get weaker and weaker and the body becomes less and less able to fight any of the inflammation and to help them to recover. So for me, that's what I took from that question. What makes it fatal? And to me, what makes it fatal is them not eating. So, I've seen really bad cases of pancreatitis where, after that initial acute bit, they're hospitalized, they have some fluids, they have some pain relief and some supportive treatment and everything like that. And then they recover and then they're fine. But these other cases where it's just really intense, really acute, like superb pain and inflammation, and the animal just will not eat. And they keep trying, they try loads of different things, but sometimes you just end up having to give up and those animals get put to sleep because they just won't take anything off their own back. It's just too painful or they feel too unwell.
Awesome. Okay. Does that cover it, do we think? I think it does.
Yeah, I think also if you don't manage it, like if they're not brought into the vet, the pain is not managed, they're not getting fluids, things like that as well can make it, a lot worse. And then the next question was, what causes a blockage in the bile duct?
Who's taking?
Deafening silence.
Oh, I'm waiting for one of you to chip in.
I mean, various things can cause a blockage in the bile duct, right? You can get like really thick bile that gets really sludgy, kind of like you might in an anal gland. You can get stones in the biliary tract that can cause blockages. You can get inflammation in the biliary tract that can cause blockages. So it's like quite a few different things. And I don't think there's necessarily, like, oh, blocked bile duct, that's caused by this. I don't think there's a definitive list of specific causes, but various things can cause inflammation or stones or sludgy bile.
Or cancer even can cause blockages as well.
Absolutely, or cancer, of course.
And then the following question was, what causes a rupture in the gallbladder? I guess it's a bit of a similar answer.
It sounds like a specific case, maybe that we don't have enough information to answer specifically because we don't know the story behind the questions or what what the problem was in that specific case. But there could be several different answers, I think, is as much as I dare say.
Yeah. All right. Should I carry on to the next question? So Jane had a question about her dog that she's fine, but she has a few warts. She's not bothered about them, and we just monitor. Yeah, when she was under Medivet, they would be writing a prescription when she walked in the door. Yeah, let's answer that question first, maybe then. So lumps and bumps. Ideally should be checked out by a vet, have them consider if it's worth removing or not. I think it's a bit of what it looks like. There are a lot of benign lumps. If you're unsure, you can always remove them and you can send them in for testing. But yeah. And
do you want to say something to that one, Vicky?
I mean, so just repeat the question. What does she want to know about lumps and bumps? Like, what should you do if you find a lump or a bump? Like, what? Sorry, I'm not quite sure I understand.
Yeah, I'm not sure if I understand the question either.
I think it's wart specific. I mean, I know there's homeopathic remedies. Lisa's probably dying to tell us all.
Well, no, I think the main point I would make about any kind of growths is that no one's got magical fingers. So I mean, my advice is always that you can't say what it is until you've got it under a microscope. So the first time, certainly a dog gets a certain type of growth, whether it looks warty or whatever it is, it may, you can feel it and say, well, it feels like a lipoma or it looks like a harmless wart, but you can't know until you've examined it. So when in doubt, I would recommend removing it so that you know what you're talking about. And then maybe if the same dog, I mean, lots of dogs as they grow older will keep developing all these lumps and bumps. And if you've removed one or two and they come back benign and they keep making lumps and bumps that look similar, then it seems reasonable to assume that it's the same sort of thing going on. But I would be very hesitant about seeing a dog for the first time, seeing a wart or seeing a lump and just say, oh, this is what it is, or this is what we should do. I always like to know what it is first. And you can only really say what it is once you've looked at it in a microscope.
Exactly. And she does have
said, I think, yeah. I was going to say, that said, I think there are scenarios where people are unwilling to have further things done to lumps. So, it's all very well to say, oh, yeah, just remove it. But I will also often say to people, so, say it's an old dog, it suddenly appeared with a tiny warty lump, it's not bothering the dog. I'm not going to say to, an owner of a 12-year-old dog, oh yeah, absolutely go for a general anesthetic and have this absolutely tiny lump removed, which, is probably this, but we don't know for sure. So I also think that monitoring is always a valid response. And if you've got any kind of lump as an owner that you want to be keeping an eye on, you can physically measure it. You can, obviously have your vets check it and see what they think it is. And if you want to sample it, sample it. If you want to have it removed. But you can also just monitor it and ask your vet what to be monitoring. Like, should you just be monitoring size? Should you be monitoring the texture? Should you be monitoring if it's uncomfortable, attachments underneath, all these other things that vets would be checking. So you're not being a bad owner if you choose to just monitor a lump, as long as you're keeping an eye for if it suddenly changes. Because if it suddenly changes or it grows quickly, absolutely 100%, I'm always with Lise, you need to find out what that is, because otherwise it could be anything.
Well said.
And I think it's always a good idea to involve your vet. Have your vet see it as well. They'll know the signs that indicate that actually in this case we should act sooner rather than later. And then mobile phones are brilliant, because these days, take a picture every week or every month or whatever, because we forget about these things. And then it's easy to see if you're not sure whether it's growing or whether it's changing. If you've got a picture of it and the data's there, you've got something to compare it to.
We do have a follow-up question. Someone's asking if aspirations is good or not, which means that you take a little needle inside the lump and you can get it out on a microscope and have a look without having it surgically removed. And you can do this while they're awake. What is your opinions on aspirations?
My experience is they always come back inconclusive. and then you're none the wiser, and if it was malignant, you may have disturbed it. So I think we have to be careful about generalizing in these answers, because it really depends on the situation, and there are certainly situations where a fine needle aspiration is the way to go, but generally speaking, they very often come back inconclusive, and then you might as well have just monitored or done a proper biopsy, is my experience.
But I mean, I agree with you, Lise, but I also think that there is a huge place for aspirations. I've had loads of aspirations come back with diagnoses for tumours as well. And sometimes knowing what the diagnosis of the tumour is helps to guide better surgical decision making. Because if, for example, although the one tumour which I prefer not to aspirate would be a mast cell tumour, if you know that it is a mast cell tumour or soft tissue sarcoma or a really locally aggressive tumour, then you actually want to know that before you do the surgery, because you have to take such larger margins around more aggressive tumour types than you would if it came back as something benign. So instead of your dog having a tiny excision just to literally cut around the lump and remove it like you would for a benign tumour, if it's malignant, you might have to have a kind of massive incision. But you don't want to do a massive incision for every lump just in case it's an awful tumour. So there is also a place for, you know, taking a biopsy or an FNA of a lump, because it can really change what a surgeon might do if they were going to go ahead with surgery. Yeah. And there are some tumours that, you know, do aspirate really well. But what I used to say to people is, if I was doing an aspiration and I felt like I didn't get any cells, I would just say, look, you know, we can send this off, but I don't think I've got any cells, so it's going to come back inconclusive. So let's make a different plan.
And if I dare say so, I mean, that's so true. And I do actually discuss this in my book as well, that you know, how I would approach lumps and bumps, and the arguments for an aspirate, and the arguments for a biopsy, and the arguments for letting it be. There are certainly situations where each one of those would be the preferred approach.
We're only quarter of an hour in.
Like you say, like a lump can feel like anything, because I've got a case at the moment that is a mast cell tumour dog, and the mast cell tumour that we're monitoring, if you did not know it was a mast cell tumour, you would swear blind it was a lipoma, because it feels exactly like that. But because the dog has had other mast cell tumours, they've had it tested and it is a mast cell tumour. And every time I feel it, I think to myself, this feels like a lipoma, but it definitely isn't. So yeah, you definitely do. You can't just depend on an assumed diagnosis by feel.
No, exactly. And once you've seen that once or twice, that's sort of what makes me say these days, I would rather remove 100 benign lumps than falsely, you know, feel one and say I'm absolutely sure that's fine, and then it wasn't. So I'd rather err on the side of caution if there's any doubt in a situation with a lump in a dog that's okay for surgery.
Because she actually also asked in the same question that her breath can be a bit pungy occasionally, and I was thinking of maybe making her a breath freshener with parsley, and asked if you had any recipes. But I think this is also a good time to have a good topic and discussion about why dogs get stinky breath.
Hey, yeah, well, the mouth is an extension of the gut. You got to remember that. So what's going on in the gut is going to affect the mouth. Sometimes it might be periodontal issues, of course, but most of the time the biome gets forgotten in this. So yeah, I mean, parsley is actually well known for being good at cleaning breath. Parsley is pretty good at cleaning the organs inside, so that's probably why it does what it does. I don't know, but Vicky would probably know if it has some kind of active herbal ingredient that cleans saliva. I don't know. I think it's more along the lines it's cleaning the tract out itself. So yeah, breath-wise, and especially if this dog's got lumps and bumps and warts as well, I don't know what this guardian's feeding, but it may be that you can shift something within the diet. So the diet is cleaner, because the skin is an elimination organ. It's the body's biggest elimination organ, really. So if there's things that are trying to get out, if it's not the cancerous tumors you guys were talking about earlier, then you want to be thinking about what's in there and how it's getting in there. Is it environmental? Is it through diet? You know, what else is happening? So yeah, I would be maybe just adding, if you wanted to use parsley, to the food, just adding parsley to the food. You don't necessarily need a special way of using it, in my experience anyway. So Vicky, what do you think? Has parsley got an active breath freshening compound?
I mean, I don't know for definite, but most of the aromatic herbs, parsley's not one I've studied a lot. What I know about parsley is more to do with, so it has sort of diuretic and kidney cleansing effects, particularly in its cleansing actions. But all the aromatic herbs, so aromatic herbs are things that like have a pungy smell or taste that you eat in your food. And that smell and taste is usually from like the volatile oils within the herbs. And there's higher volatile oils in more pungent herbs. So, you know, like sage and rosemary and thyme, those are all really pungent to use in cooking. And those have really high volatile oil levels. And those volatile oils are often antimicrobial. So, you know, any of those herbs you can, you know, infuse into a tea and use it as like a wash for wounds and things like that. So it could be that some of parsley's effect is to do with that, or it may just be that something to do with the particular smell of parsley cancels out certain other smells from within the breath. But this is me extrapolating from what I know rather than knowing for definite. But I agree, I would just add parsley to the food, but also, like you said, look at the microbiome. So, you know, look at potentially feeding some prebiotics and doing other things that are going to help support the overall microbiome. Obviously get their teeth checked, because if there is, and it could just be, you know, like a very back molar that is really bad, but the rest of the teeth look fine. So if it's a new problem, definitely get your vet to check it out, because you don't want to have some rotten tooth at the back and you're just helping the microbiome, because that's obviously not going to resolve it. Yeah, well said.
And going further with the questions, Claire had questions as well. So oh, this is an interesting one. I have a 4-year-old rare breed. It's Thai lilac point, and he's in Titer, and it's the only one in the UK. So it's important for like breeding. And so he has a pair of testicles, they're both out, but he had not had a fruitful mating yet. So my vet has no idea how to test for fertility or artificial insemination with cats. His sex drive with the 4 lovely girls that have visited is lacking. So yeah, currently he's on untamed tin chicken and turkey duck food, but he's been raised on Royal Canin, but is not a part of his diet now. Is there anything to increase his libido and sperm health?
How old was he?
Wow. Let's see, I don't think 4 years old.
I would say that if you're serious about wanting to breed, you need a vet who specializes in reproduction, and there are quite a few around, and that would be the way to get. I mean, if your vet clearly is an all-round vet and not a reproductive specialist, and I think if you want to be, breeding in a serious way, you need help. You would need his sperm count done in any case. So that would be my advice, to take him, to get an appointment with a vet who specializes in reproduction, and go and see them, and you know, bring a list of questions and get lots of advice, rather than sort of.
Agree with you. I think that if you got them checked out by a repro vet and they're reproductively sound, but they still have a really poor libido, then I would go and see a homeopathic vet, because you know, maybe that's part of a homeopathic picture, that if you got the right remedy, you could help to resolve that. But it could be that actually there's something else going on with the reproductive system, like a poor sperm count or poor hormone levels, which is causing a low libido as a secondary problem. So I think that until you've sussed out the repro, like Lisa said, then the libido, I think you kind of just have to ignore it, because it might just be that he's not quite ready.
Yeah, I think it's important what they say, like try to figure out firstly, like, is there something like physically wrong? Like, do your testings, maybe you can check the hormones. I've actually seen how they collect sperm in cats is quite interesting. I saw it on a leopard, they sedate them and then put this electro bead up, and then they stimulate them to ejaculate while they are sedated, and collect their sperm. And then you can look at it under microscope and, you know, see if he has good swimmers and if everything is working well. So I think the first step would be like to really get to a specialist, and check that everything is working well. But if everything is perfectly fine and still nothing is working, actually acupuncture as well is shown quite effective in treating reproductive issues. So I think that could also be something that you could consider if you check and everything is working well.
I mean, also maybe herbs. It's not something that I've treated with herbs, but there are herbs that help to support reproductive health. And I'm sure that there's loads of info in humans about boosting male libido with herbs. So I'm
Nutrition.
sure that is something you
Aphrodisiac. All right, and then to further on with the question. So Blaze has a question, quite interesting. So my dog has lost some pigment on her nose, and now it's getting a bit pink. And she's almost 5 years old, beagle, and has no health issues, raw fed. Should I be worried? And what's the best and safest supplement to get her pigment back?
We used to use elderberry, I want to say. Does that ring a bell to anyone? Sure, we had elderberry supplement for pigmentation back in the day.
I wonder why. I don't know if it's a show dog or something. I mean, I wouldn't. I don't know. I just, if for something that if it's a cosmetic issue, I don't really. I wouldn't do anything.
The guardian is probably wondering if it is. If it's cosmetic, or if there's a reason.
Yeah, so what I'm thinking is there's can be a few different reasons of why they can lose pigment on the nose, but obviously if nothing else is wrong, there's no crusts, there's, you know, nothing else obvious, there's maybe two things that I can think about. Something called Dudley nose, which basically is like an hereditary genetic thing that they lose pigment, and it's really just a cosmetic thing. It's not, you know, harming them in any way other than, you know, potentially getting a sunburn, so maybe you need to be a bit careful in summer with going out. And the other reason would be, I forgot the name of it, but they can also, like people, have some kind of autoimmune disease that are attacking melanocytes, which are, yeah, things you could consider to like try to find the root cause. So you can, I think some vet clinics at least can check for it, do a genetic test to see if they have the gene for losing pigmentation, and yeah, potentially try to rule out if they have an autoimmune disease, because then obviously you would focus on lowering inflammation. But I think finding out what it is would be the first step.
But I mean, if like, you know, if there isn't anything else wrong, and you know, I wouldn't automatically be like, we need to assume it's autoimmune, because if it is, you know, like I've seen lots of cases of discoid lupus where they get, you know, quite advanced nose pathology from an autoimmune condition, and you know, maybe for some cases that has started with something like a minor pigment change within the nose, but it would progress to something else. So I feel like if it's just changed and has remained in this changed way and doesn't continue to change, then it could just be that you need to just keep an eye on it, because I know the pigment in my dog's nose has changed over his life. He used to have loads more of the pink, and now he's got much more of the black. So pigment changes do happen. So maybe just monitoring if it's not progressing would be okay.
Or looking at the elderberry. Do you not know that about the elderberry supplement? I'm convinced we used to use it for pigmentation.
I've never heard of elderberry for pigmentation.
I've never heard of it.
You know, when I'm learning herbal medicine, we're treating conditions, not pigment.
Yeah, well,
things.
true.
So,
I think Dean's had a supplement for pigmentation which had elderberry in it. I just remember it for some reason.
I would just think that the main issue would be, you know, if it's not sore and it's not crusty and it's not like ulcerating and it's not itchy and it's not, then I would do exactly what Vicky said, and I would just keep an eye on it. But I wouldn't be concerned about what do we do for pigmentation. That doesn't seem the main point to me. I would be just monitoring it, and if it develops or if it becomes something that bothers the dog or something that worries the owner, then I would, the point for me would be to find out what it is, and then find out how we could treat it, to treat the cause of it, rather than be concerned about getting the pigmentation back. That's
yeah, hopefully we've given them some ideas what it could be.
Which is most likely, I would have thought nothing. I mean, it's most likely just to be pigmentation comes and goes in humans as well.
So going further with the questions, there's a question from Claire. She's asking if there is any natural treatment that can help a partially collapsed larynx. 15-year-old Jack Russell, otherwise fit and healthy.
Yeah, I mean, loads you can do for that. But to me, there's loads you can do for any of those kind of weak upper respiratory tract issues that develop in old age. But obviously, the main fix in younger dogs tends to be surgical fixes, particularly for laryngeal paralysis type issues. But in the older dogs, you're never going to go down that route. It's to do with a weak nervous system. So things you can do to support the nervous system. I really like lion's mane. Lion's mane stimulates production of nerve growth factor. So that can be really good at helping the nervous system to repair and helping older dogs with brain function as well as overall nervous system function. And then in the respiratory tract, a lot of the symptoms that you get from these problems are due to secondary inflammation in the respiratory tract. So if you can help the secondary inflammation, and I've had some really good results using various different herbs for these type of problems, if you can reduce all that inflammation, the symptoms are hugely reduced. So even if you can't actually fix the nerves, which in a 15-year-old dog you probably can't, then at least you can help reduce the symptoms. And obviously, as I'm sure Lisa's about to tell us, homeopathy is also really good for these cases.
It is. And I think the main point I would want to make is that I wouldn't think of what do we do about, this problem. I would think in terms of how do we support this elderly dog in a more sort of, well, at the same time, more general way, but also kind of deeper way. How do we support the dog in a rounded way? So it's part of a picture, and the answer will be different depending on what else is going on with the dog. But it's a really interesting point about nerve growth factor that it is something that we want to support. It's something that we want in the body. But if an elderly dog, for instance, is getting like Librela shots for arthritic pain, you're doing the opposite. So kind of just an example that you need to look at the whole picture and need to support the whole dog and all of the conditions that are probably present at the same time in that individual. But there's lots that can be done. Yeah.
And I also want to add this because we have so many good studies on this in horses. Laryngeal hemiplegia has been treated successfully many times in a lot of studies with electroacupuncture. So I'm thinking maybe something similar could be done in dogs. It works really well for like recovering the nerves. So obviously it depends a little about the cause, if I don't know, there's a tumor or something pushing on a nerve, then obviously, it depends on the underlying cause, and also how long it's been. If it's been, they say that if they have the issue for 3 months, it's going to take you 6 months before you even see that it starts to get better. So if it's been there for a shorter time, obviously the prognosis is a lot better. But I think this is a good case as well for acupuncture.
This kind of comes back to what Lisa's saying. In the geriatric patients, it's a kind of a multimodal approach is often the best, because the older dogs and cats and all species have lots of different stuff going on with them. And it's not necessarily like one big pathology like cancer or something. It can be loads of tiny little pathologies that overall are having a similar impact on their quality of life as one big pathology would do. So, it's probably not just that it's got a bit of laryngeal paralysis, it's probably also got some arthritis and maybe a little bit of cognitive decline or weak hind limbs or a bit of renal or liver dysfunction or something like that. And that's where the kind of whole health approach is much better, because if you can strengthen the whole body, then all of their symptoms are going to be improved, and therefore their quality of life is going to be better, and you're going to help them to age better.
Well said.
Yeah.
Anna had a question regarding Parvo. She said, I was told Parvo is more prevalent in black and tans. Why is that? And if you choose to vaccinate, should you have all 3 Parvo jabs?
I don't think, I don't think it's that black. I don't think the issue is that black and tan dogs are more likely to get Parvo, but it has been known for a long time that black and tan dogs often respond less well to vaccination. It seems that the gene that codes for that color combination is to my very limited genetic understanding, is just situated quite close to genes that predispose to being a non-responder in terms of vaccination. But even before we had titer tests available, it was kind of known that if you had a Rottweiler or a Doberman or something like that, best give them an extra vaccine, because they just often got sick even though they were vaccinated. But now that we've got titer tests, it's become clear that these, I mean, any dog can be vaccination non-responders, I should say. There's a certain percentage of dogs that just don't respond to vaccination. No matter how many vaccines you give them, they don't respond. So you can inject them all you like, but they'll never be immunized. And not all black and tan dogs are vaccination non-responders at all, but they are more common among black and tan dogs. So they are more likely to be susceptible to parvo, even though they have been vaccinated. So it's not really about the number of vaccines, but they may not respond at all. And the only way to know is to do a titer test. So that's what I would absolutely recommend. But I think all dogs should be titer tested. And that's how we know, and that's how we find the vaccination non-responders.
Yeah, we mention titer tests every week for that reason, don't we? That they're so vital to understand what's going on with your dog in terms of immunity.
Absolutely.
Just to add about black and tan dogs, because somebody asked me this via email recently, actually. Black and tan means dogs that are both black and tan. So like Rottweilers and Dobermans and things. It's not all black dogs and all tan dogs.
No.
Because I had an owner of a black dog email me because she was really worried that her black dog might not be responding. And I was like, no, don't worry. It's black and tan, the combination. It's not black dogs and tan dogs.
Sure. Brilliant. But I mean, the last vaccine non-responder that I saw was a Dalmatian. You know, it can happen in any breed. It's just more common in black and tan dogs. Say it as one word. Yeah.
All right, and carrying on with the question. So Amana had a question, which I'm not sure if I understood correctly, but from what I understood, she has a 2-year-old Yorkie, and I think she's gaining weight. She has delayed seasons and long hair growth, and she's wondering if hormonal imbalances can have something to do with it, and potentially what blood tests that we recommend.
I think this is Amana, who's one of my clients, actually. I think I've had some consults with her. She wanted to do the nutrition course as well. She has a Chihuahua as well. If it's her, yeah. Well, we'll answer anyway. But yeah, if it's her, then she's welcome to book another consult to talk about the food. Weight's involved, but yeah, go on. Let's see what you think about the rest of the question.
The issue was that the dog was overweight, and
the way I understood the question, yeah, she wrote, can hormones imbalances in an unneutered female stop weight loss, delay seasons, and long hair growth?
Delayed seasons, not to delay them, and long hair growth. Well, it does sound endocrine linked, but I'm pretty sure I said that on the consult. But yeah, I mean, I think Amana probably wants to know, if she was to go to the vet, what sorts of things might she ask the vet to look for, perhaps? So what tests would the vet?
Well, the vet would know what to do. I mean, I'm not sure I understand the question properly, but the way it read, it sounded to me like the assumption was that it was sexual hormones. Maybe I didn't understand it properly.
Yeah, no, I think you're right. I think that is the question.
Yeah,
I do. Sexual hormones, I don't think a sexual hormone imbalance will be responsible for the dog being overweight or have coat changes. No, I think it's more likely to be something that's not related to sexual hormones. But I think the really frustrating answer that I can come up with would be to go to the vet and just have them have a proper physical examination and see what they suggest. But it doesn't sound like a sexual hormone issue to me.
it could be more of a biome issue, but if it's who I think it is, then they did have the test, but maybe not on this dog.
I mean, it could have Cushing's, it could be hypothyroid, it could have, there's lots of issues that could be there.
For a young dog.
How old was the dog, sorry?
2 years old.
Right. Sorry.
And I mean, like hormone changes generally, I think if one hormone in the body is affected, then the others are going to have some kind of impact on them as well. So I totally agree. I think it just needs checking.
Yeah. It sounds like an endocrine issue, and yeah, obviously it's quite young dog, but there could be other reasons for it as well. So I think doing a proper physical exam and then seeing what the vet said, you can test a lot of these hormones on blood samples anyways.
But you can work homeopathically with the endocrine system. So, you know, if you've got a diagnosis, then I think you should find a homeopath for sure.
An acupuncturist.
Or
or a herbalist. Yeah. But like Caroline said, exactly how the dog is going to be treated. There's lots of different options, but it all comes down to what's the diagnosis. And wanting holistic treatment doesn't mean we don't need to know what's wrong. The diagnosis comes first, and then we know what's appropriate in terms of herbs or acupuncture or homeopathy or conventional treatment or any combination of those options, I think. But first we should know what's wrong with the dog.
Absolutely. Root cause first. There was actually a question here as well that I wanted to answer in the chat under the live. So Karen's asking, she said she had an 8-year-old Cocker Spaniel who just had surgery in his spine for vertebral disc burst and the matter calcified. Not all matter was removed, but is doing great. Any advice on supplements and so on? I just wanted to add that I actually just made a PDF on my website, which is one of my first products about IVDD in dogs. If anyone wants to read it, it says everything you need to know about IVDD in dogs and follow-ups and grading and so on. And I also wanted to add that acupuncture works really, really well. And I always recommend it to any with spinal issues, IVDD, and similar. Yes, in the studies that I was going to share as well, it actually performed better than surgery in many cases, which I think is very cool. Anyone have anything to add on herbs or similar?
I mean, I will definitely just go back and say lion's mane again, because if you've had any kind of surgery that involves the nervous system, why would you not want to stimulate nerve growth factor, which is going to help your nervous system to repair itself quicker? So I think that would be a biggie. Anything post-surgical, there's lots of post-surgical homeopathic remedies that you can give that are really supportive. Obviously, the big one is arnica, also hypericum for incisions, calendula for wound healing. So lots of other things that you can kind of be doing to assist the body generally, but definitely lion's mane is my big one for any kind of spinal injuries, and acupuncture and other, you know, physical therapies. So, you know, getting like a physio involved, or, you know, someone else that can help give exercises. I don't know what other symptoms the dog's got. So, you know, does it need some hydrotherapy to help rebuild muscle, to help with muscle tone and rebuilding muscles if it's got any muscle wastage? Like, is this an acute or a chronic problem? How long has stuff been going on? Also different, you know, like photobiomodulation. That's something that owners can do from home if they buy a unit that can help with pain and inflammation and help encourage recovery. But these are all kind of general for surgery, whereas I think for spinal specific, lion's mane is my big one.
I also have just adding that on there as well. I just made a PDF on acupressure if you want to do a little bit of massage or acupressure at home for joint conditions.
Do you want to? You should put your website on when we post this video,
sure.
Tina. Just make so that you know it's easy to find.
Yeah,
Can I ask one question, because I want to ask it when Vicky's here? I just got that someone called Richella, I think Richella Murphy, asks, do you recommend giving dogs Echinacea powder, rosehip powder, and fennel seeds on a daily basis, or not at all? I have no idea what the background is or what she's wanting to treat. I
mean, you know, you could. Like I say, we've got no other information. I mean, all of those are, you know, Echinacea is a pretty safe herb. Fennel, that's basically like a food herb, a cooking herb, and most of the cooking herbs are quite safe. A lot of it depends on the amount that you're giving. If you're giving something all the time, you want to make sure that you're giving the right dose, because if you're giving too much, it's really easy to overdose if you're doing it all the time. Whereas if you're giving a short course and you give a bit too much, it's less likely to be a problem. Also, you know, if you're trying to treat something, are those the best herbs? I don't know what you're trying to achieve with them, so it's really hard to comment on that.
But yeah,
but those are relatively safe herbs.
You'd want to see a change, wouldn't you? Either from symptoms or something to change in the dog, unless you're adding them for a nutrient value that you feel is high in.
I mean, like rosehip, a lot of people add because they want to increase vitamin C and support the immune system. Echinacea equally. And there are some cases where I would give a herb on a long-term basis. For example, if I were to get a giant breed or a flat coat retriever or a boxer or a very cancer-prone breed, I would be feeding that dog mushrooms from the moment it entered my household. And you could potentially say the same about Echinacea as an immune system support. Because I would want to have that chemo preventative effect. But, you know, I don't know what this lady's trying to achieve with those herbs to be able to comment on if that's appropriate usage or not. But you can use herbs long term for nutritional and medicinal reasons, but it just depends what you're trying to achieve.
Actually, I think we just got another good question for Vicky that I just wanted to mention now. Someone's asking for good herbs for sedative effects before vet appointments.
So I would tend to doing a combination where I used calming herbs alongside some kind of L-tryptophan based supplement, because I think the L-tryptophan supplements work really well for pre-vet appointments, and there's some really good ones. Some of them combine with a herb, and those can work really well. But easy calming herbs, so obviously skullcap and valerian, they're often really readily available in combination. Dor West do tablets with those. Passion flower and lemon balm, those are really gentle, relatively easy to find calming herbs. I'd say those are probably the easiest. Chamomile as well. Chamomile's quite calming, but maybe not as potent as passion flower and lemon balm. Those will be the easiest ones to find in a supplement form. If you go to a herbal vet because your pet is, you know, super anxious and you want something a bit more pokey, then they'll be able to make you up an individualized herbal mix that will be a bit stronger that you could use alongside your L-tryptophan supplement. But I kind of go up in stages with anxiety with the herbs. So often I'll just start with an L-tryptophan based supplement and then do that plus one with herbs in. And then the next level is that tryptophan supplement plus an individualized herb tonic, which I can make quite pokey with herbs that I wouldn't necessarily recommend owners use, but I would put in a mix for the dog in, you know, relatively small amounts, but combined with other calming herbs.
And these supplements.
Oh, go on. I was going to say, surely they have to have them for a little while for it to sort of be with the system. Is that what you were going to say, Tine?
Yes.
We're thinking the same thing. I mean, I guess there will be some herbs that have more of an instant effect, but I would have thought, do they not have to have them for a little while?
The supplements, so not always at all. I mean, lots of these calming supplements, you can very often just give them, you know, maybe give a double dose, give it a couple of hours before the vet visit, and sometimes it's remarkable.
Double dose.
I find, but you can do it just for a one-off. You know, we're going to the vet now, or we're going on a long car journey, or we're doing something that stresses my dog out. But I find the response is very, very variable. I mean, different individuals respond to different supplements, so it's worth just playing around with it a little bit. But some dogs, it's unbelievable. Like dogs who are petrified of having their nails clipped or something, and then you give them the right, and it's just a supplement. You know, there's nothing sedative in there. And they're just fine.
But the way herbs work, it's really important for people to understand that herbs do have some amazing instantaneous effects. So, you know, if you're feeling stressed, you have a cup of chamomile or valerian tea or something like that, you do feel calmer. If you're having really bad gut cramps and you have some fennel seed tea, you can almost instantly feel it relieving it. Same with period pains or something like that. That, you know, that's one cup of tea and that has instantly made you feel better. So herbs do have amazing instantaneous effects, but they also have building effects. So Herbs tend to reach their maximum effect around 6 to 8 weeks after you start taking them. So I always say to people, I'd expect to see something within the first couple of weeks, but then it will build up over time to 6 to 8 weeks. So the big thing that people come to herbalists, vets for calming is fireworks. Mm-hmm. So if someone comes to me asking about fireworks night and coming up into that time, I always try and get them to come and see me and start herbs at least 6 to 8 weeks before bonfire night, so that you've got time to have the dual action of the herbs. So you've got the dog overall much calmer, but you're also giving them calming on the night itself. So you kind of end up having more of a dual effect. If it's a vet visit, you know, you're not going to have your dog permanently on calming herbs just for that occasional vet visit you might have to do. And that's where the L-tryptophan or the other instantaneous effects you're going to get potentially a better result from. But if it's a long-term or really severe phobia that you can predict, that's when your kind of longer term use of herbs works really well too.
Yeah. Do you know what, as well, if you go to my website, which is here, the Canine Flow one this time, you will find some really amazing professional canine hypnotherapy audios, because I would say if the dog is getting stressed enough in that one situation for you to think, okay, I really want to be giving my dog something, instead of just managing it at the time the way you do behaviorally or training wise, I would say there's probably other times that the dog is feeling stress, and it may be that you don't notice so much, or you can find you can manage that situation far more easily. So something like therapy, Canine Flow, if you study the course as well, you'll understand how the nervous system works better and how we can reduce the levels of what I call like stuck emotional energy that's in the body, because it will be held somatically, and we can really help our dogs by using something like the hypnotherapy audios as well. So sometimes, a bit like the herbs really, sometimes you have to play them a few times before you see any changes. Sometimes people buy them and then like the next day they're messaging me saying, oh my God, I can't believe it, my dog didn't react to fireworks for the first time in like 5 years or something, and all they did is play the audio. So it depends what's going on for the dog, what needs to shift in the dog emotionally as well. But I would always look at any behavior like that as not that I don't think herbs are tremendous, but not just what can I give them to solve the problem now, but what actually is going on completely for the dog as well.
And it doesn't have to be one or the other.
We do both. Goodness, yes. Herbs can nourish the nervous system emotionally, for sure.
But also, I think something really basic on a non-holistic at all level is that if your dog's really anxious at the vets, talk with your vet about it. Talk about what you can do to improve this scenario for them. So, you know, is it the stress of all the other animals in the waiting room that they hate? Is it being examined? Is it that they're really protective of you and therefore they feel that when the vet's trying to do something to them, they need to be protecting you? So would they be better if the vet took them out of the room? And, you know, different vets and different practices, your dog will get on better or worse with. So you need to, you know, cool up before your appointment and say, my dog is really anxious. Is there a vet that's really good at working with anxious animals? Because, you know, or, you know, can you have a double appointment slot booked so the vet can spend the time, you know, sat on the floor with the animal, give them some treats, do some talking, or in some cases, just completely ignore them for, you know, 10 minutes and then let them settle into the room and the scenario. So it's like loads of medication, whether conventional or holistic, lots of things you can do physically, or, you know, even go in every week and weigh your dog on the scales, let it get to know reception and have some treats and some of the other staff, so that it's just a normal thing to go into the vets and then, oh, sometimes they have to examine you. There's so many different ways that you can help anxious pets at the vet that don't involve herbs or meds or hypnotherapy or anything, that just are basic, like animal handling and working out what it is about the vets that your pet hates and trying to work with that.
Yeah, and it's so much is happening in this field. I mean, most vets are aware of low stress handling and better at dealing with it than they were, you know, 30 years ago, when it was just kind of, you know, get more people in to hold them if they won't stand still. It's it's you know, that sort of thing doesn't go anymore. Thank God. So yeah, absolutely.
So we have time for one last question. So this one is about ears. So Alison is asking, because only the left ear gets black gunk. When it gets bad, she shakes her head, and then it gets red and inflamed. Been to the vets, even different practices several times, given ear cleaner and ear suspension, been told ear infection, and have taken chicken out of her diet and all poultry. Still gets every few months. Any natural remedies or suggestions? Thank you.
Microbiome. Yeah, I mean, is this yeast, and can we find out what is actually in the ear? I mean, maybe this is written on vet notes and the Guardian isn't aware of the terminology. So I would find out what it is, maybe, because it might be yeast, it might not be. Topically, honestly, the Dog's First propythium is amazing, so definitely try that. It is, as far as I'm concerned, it's the best thing I've seen so far. So if that doesn't work, then we really need to think about it. So, I mean, it could be diet. Of course, it could be diet. It could be something in the diet that's feeding the yeast. So, you know, all these things need to be thought about. But I think, yeah, if you want something topically immediately to go and help the dog, that product is for sure the best one.
It's a yeast eating yeast, isn't it?
It is yeast eating yeast. It's fabulous.
The product.
But I mean, I think with ears, there's also loads of complicating factors with ears. Ears are quite often like a single part of a chronic complex skin case. And it might just be that this is the first thing you're seeing. And yes, it's only one ear, but that doesn't mean it's not going to affect another ear or the skin in the future. So, you know, a lot can be immune system related. Also, if it's just in one ear, is there something else abnormal about that ear? Like anatomically, you know, are we talking about a spaniel whose ear starts halfway down its head and then flops down and is really hairy? Is it a poodle whose ear canal is super hairy inside, and so there's lots of irritation there? Does the dog swim a lot, so it's getting water into its ears? You know, there's so many factors involved in ear problems. It's not necessarily like, oh, it must be diet. If we change that, it'll resolve the problem. Sometimes you see that with ears, but that's not common. That will be the first thing I might try because it's easy. But actually, more often than not, that is not it. It's just like dipping your toe into the complex skin case pot. And as we've talked about in these things before, complex skin disease needs more complex care than just finding the right ear cleaner.
Yeah, certainly.
Amen to that. Yeah.
Certainly the ear cleaner is just not going to solve it. And that is really all you get when you go traditionally to the vets, is that way of looking at it. And I don't see that work. On a very
but that said, you know, like if you have a good ear management routine, I do know some spaniels that just have like quite poor ear conformation and ear design, and so if the owners don't check the ears weekly for any kind of change and clean them when they need cleaning, then they can develop an infection. So, you know, if your dog does have poor ear anatomy or swims a lot or any of those things and they keep getting these problems, sometimes you can use it as a kind of preventative approach to stop it from getting worse. But you should also be aware that there could be something immune system related going on underneath.
Yeah, I think there's almost guaranteed to be. I mean, if you have recurring ear infections, then it's not an ear problem. It's a systemic problem, and it's I mean, it's an allergy. It's an immune system problem, and if you ask me, it needs a homeopath.
Yeah, I talked a lot about ears, I think, in a previous live as well, because obviously when their ears are hanging down, there's get moist and it doesn't dry as well as the ones with their ear pointing up. So I always say, like, every time you go swimming, if they're out in the rain, just clean them out, make sure they're dry. Some of them do better, at least from what owners have told me, that some of them do better if you pluck the hairs, so it's not that much hair down there. There's lots of ways of managing it, but obviously if it keeps recurring, we have to really remember that, like, yeast, if there is yeast, which it probably is, also needs sugar to grow. So I'm always very big on any kind of fungi infection to try to, like, do a diet limited with sugar, because they really do need that sugar to switch into their pathogenic form and become a lot of it. Obviously it can happen regardless, and is a big microbiome question here as well. What is the microbiome looking like? So yeah, I think diet and management and figuring out what food work for them or not. I saw you eliminated poultry, which is a common allergen, but obviously there's a lot of other foods as well that can trigger. It's just like one of the most common things because poultry is in everything. So obviously everyone will then be allergic to chicken. So yeah, I also do have a free resource on elimination diet if anyone wants to try that, in the link in my bio as well, and on my website now. But yeah, I think ear cases is a bit of a ongoing management thing, and sometimes it resolves completely. I've had quite a few cases where, especially if they've been on kibble, they've switched to like a rabbit raw or something like that, and then they almost never have ear issues again just due to that. But obviously they will have other issues because there's more to it. But yeah, and I think seeing a holistic vet, homeopath, acupuncturist, herbalist, to help you further with their overall health, because obviously there might be some underlying immune system problems here as well.
Do we have any other questions? Or
we have 3 minutes. There is one that we probably could do. So
I promised my student Lana I'd ask about oxalate, but we can do that next time.
Okay,
that sounds like a longer answer than the 2 minutes that we've got.
I agree.
I've got a really, really short one. Catherine asked or said that she was struggling to find a local vet to do a vasectomy. And that really, really surprises me. And I'm wondering whether she might be just looking at websites to see if it's listed as something they offer, because I find it hard to imagine that if you call around that vets would say that they don't do that. It's very simple.
That does not surprise me at all.
Seriously.
Yeah, does not surprise me at all. I've been asked it a lot of times, especially since leaving practice, or leaving doing surgery. Now I just do the holistic medicine. I think this is not something that is widespread. I think since the WSAVA guideline change, I suspect some more vets are learning it as a technique, but the fact that it's not widely available does not surprise me at all. I think you would have to look for that quite a lot in your area before you would find someone that's happy to do that. I'm hoping that is going to change and that more and more people are going to learn the procedure, because from what I can read and look at, it doesn't seem like it's overtly complicated. It's just not what people are used to.
It's simpler than a normal castration. It's really simple. But
for sure. But as someone who's done both, it's easy to say that. But if someone said, like, oh, make a pot on a wheel, it's easy. If you've done it loads of times, sure, making a basic pot is easy. But if you've never done it before, then it's going to be complicated. So like any new surgery, if you've never done it, you're not going to be happy about offering it if someone asks. You're going to have wanted to do some kind of course or extra study or something. So hopefully more of those kind of CPDs are going to come out and more people are going to have it available. But I'm not surprised by that.
Can I say two things? I think the first thing I want to say is I'm wondering why she wants a vasectomy, because I would hope that it's not just, oh, we're not castrating like we normally did, now we all have to do vasectomies instead. That seems like an unfortunate way of thinking of it to me. What I would do as a go-to would just be leave them intact. But if there is a specific reason why Catherine feels that she's not going to be able to stop her dog mating, then sure, there are situations where a vasectomy makes sense. Or if she signed something, got a dog from a shelter and signed something saying that, he would not be left intact or whatever. But for most dogs, I don't think that we should think we're not castrating anymore, they all need vasectomies now. That would be a slightly strange way to think about it, to my view. But the other thing I was going to say, I just find it hard to believe what you're saying, Vicky, because it's such a simple thing to do. But I would suggest that we start a campaign and that anybody who listens to this video phones 10 vets and asks them if they do vasectomies, because the thing that drives change is people. If a veterinary clinic gets 3 calls in a week asking about vasectomy, one of their vets is going to work out how to do vasectomy and they're going to be offering vasectomies. I mean, that's how something like that gets to be a standard procedure. And that's easy to do. If everybody calls, sit down for 15 minutes and call all the vets that you can and ask them, do they do vasectomies? Because, that, please.
I think it will change. I really do. It just doesn't surprise me that there aren't many people offering it yet.
Let's change that.
And if anyone knows of a vet that is offering it, then write in the comments, because then other people will be able to find that.
Yeah,
there's a Facebook group that lists veterinary clinics that offers vasectomies and ovary sparing space. We can put a list to it. It's called the I can't remember what it's called. We'll put a link to it on this video.
That doesn't sound good.
Yeah, something something.
Oh, okay.
Parsimus Foundation or something.
Someone also asked if we can do one for titer testing as well, like what clinics have in-house titer testing.
Oh, thank God, there's too many of those.
Change. I mean, yeah, but don't forget that Titer testing, they do it for travel. So they damn well do know what it is. They're just having you on if they're saying they don't know what it is.
Yeah, it's just sometimes
passport, they'd have to do it.
When they send it out, it costs a lot of money. That's a problem.
Wow.
I'm pretty sure that BioGal, who supplied immunocombs for the in-house Titer testing kits, I'm pretty sure they have a map.
They do. We can link to that as well.
So, yeah, you can just look on the BioGal map and
let's get that up on the Holistic Vet Sisters. Yeah. Okay, so we're at time. So we will do the oxalate question next week. And who are we with next week? Who's our sister?
I know who we're with, and I've forgotten already. Oh, Vicky recommended some Scottish herbal vets.
Oh, the
Regan,
herbal vets,
maybe
Regan. Yeah. Or is this?
We've got herbal vet coming next week.
Oh, okay.
I'm almost sure. I think so.
Yeah, it's Regan.
Yeah.
But she has a sister who is also a herbal vet.
I was wondering if they were sisters, because I looked at their website and they look so similar.
Twins.
They're twins. Regan and Jordan. Yeah. They're amazing. You're gonna love them.
Oh, excellent.
Wow. I love it. The Holistic Vet actual sisters. It's terrific. Brilliant.
Should have them both on.
Exactly. We should. Okay, thank you for watching, everybody, and do add your questions, and also do share the fact that we offer this Q&A service, won't you? Because I never get around to. I always each Thursday think I'm going to tell lots and lots of people, and I did it for about probably about an hour ago. Well, it wouldn't have been an hour ago, an hour before we started. So yeah, please tell people, because I know that there's lots and lots of people that have got questions. So we're really happy to answer them.